Well, we all know that March is Women's History Month, but did you also know it's Endometriosis Awareness Month as well? Endometriosis is a condition that affects roughly 10% of reproductive age women and girls around the world. That's according to the World Health Organization. I sat down with the Chief Medical Officer of Aetna Better Health of Illinois to learn more about this condition.
Endometriosis affects a lot of women is what I've been kind of gathering from some of the research I've done on my own. What is endometriosis?
Okay, so endometriosis is a condition that affects, people who menstruate. So that generally means women who have tissue growing outside of the uterus. So the endometrium is the lining of the uterus. So the word endometriosis comes from that word endometrium. So it's when that lining of the uterus is found outside of the uterus. So it could be found in the lower belly, in the pelvis, in the vagina, and the lower back. And so there are these implants of that endometrial tissue that continues to act like it's inside the uterus. So you can have pain and cramping because of these implants that are outside of the normal place. You can have bleeding more than usual during your period, and at other times, there can be difficulty getting pregnant, blood in the urine or stool, and pain during sex caused by endometriosis because it's outside of the normal endometrial lining of the uterus.
Are some more at risk for it than others?
Yes, that's true. So like a lot of conditions like fibroids, infertility, there are risks that can be associated with developing endometriosis. So if someone in your family has the condition, that puts you at a higher risk. If you had a period that started before age 11, what we call menarche, when the period starts, if you started before age 11, you're at higher risk. And then if your monthly cycles are shorter than 27 days, the normal is 28 days, that puts you at higher risk. And then if your period is heavy or lasts for more than 7 days, that also puts you at higher risk or could indicate that you have endometriosis.
And is endometriosis something that a woman has for the rest of her life?
There is treatment available. So depending on how severe it is, so if it's mainly pain and discomfort, obviously pain medicines can help with that. Sometimes a prescription hormone medication is needed in order to reduce, the activity of the implants. And then there are procedures to actually remove those implants. So that endometrial tissue that's outside of the endometrial lining of the uterus can be removed, and that can help in people, especially that are trying to become pregnant, because if it's affecting, something like the fallopian tubes or the ovaries, that could interfere with fertility. So a procedure in that case is warranted oftentimes. And then in extreme cases, sometimes women have to have either the uterus or the ovaries or, other affected areas removed in order to get rid of the symptoms. So there's lots of treatment options. The key is to discuss your symptoms with your physician. And so again, make sure that you advocate for yourself if you have any of these symptoms and ask them directly, can I be checked for endometriosis? You can also call Aetna Better Health of Illinois at 1-866-329-4701. And the Well Women visits and annual checkups are covered at no charge by Aetna Better Health of Illinois for eligible members.